What are the latest changes in telehealth insurance regulations? Imagine trying to schedule a doctor visit and suddenly realizing the rules have shifted. That's what many patients and providers are experiencing with recent updates in telehealth insurance. Let's break down what's new so you can navigate these changes smoothly. As of October 1st, 2025, big shifts happened in how Medicare covers telehealth services. They are rolling back many of the relaxed rules put in place during the COVID-19 emergency. Now, Medicare patients generally need to be at specific locations called originating sites to qualify for telehealth. These sites include provider offices, hospitals, or skilled nursing facilities, especially in rural areas. Patients' homes are only accepted as originating sites if they meet certain exceptions. This means if you are in a city and trying to do a telehealth visit from your home, you might not be covered unless you qualify under special rules. However, behavioral health services and care under programs like accountable care organizations still have some flexibility. You can often have mental health sessions from home without worrying about location restrictions. Another change is about audio-only services. During the pandemic, many Medicare patients could get covered telehealth visits just by phone. Now, audio-only coverage is limited. It's only available if the patient cannot or will not use video technology and the provider documents why. This reduces the broad access many enjoyed before. Provider eligibility has also changed. Certain professionals like physical therapists, occupational therapists, speech-language pathologists, and audiologists are no longer able to bill Medicare for telehealth services after September 30th, 2025. This narrows who can offer remote therapy through Medicare. Billing adjustments are part of the new rules too. The temporary boost in telehealth reimbursement rates ended on January 1st, 2025. Now, payments are slightly lower for telehealth services. Hospitals can no longer bill for outpatient therapy, diabetes training, or medical nutrition therapy if done remotely, unless they are in specific programs. Flexibility remains for clinicians in Medicare shared savings, program accountable care organizations. They can still provide telehealth without geographic limits and bill Medicare through 2025. Private insurance and Medicaid policies vary a lot by state. Many states are still supporting telehealth reimbursements, but coverage details differ. Some private plans continue to pay for telehealth at similar rates as in-person visits, while others have tightened restrictions. There is ongoing legislation in Congress aiming to make some pandemic-era telehealth rules permanent. A bipartisan bill is under review that would allow Medicare patients to access telehealth from home and keep telemental health services flexible. But it has not become law yet. For patients, it's important to verify if your location and provider meet the current requirements before scheduling a telehealth visit. Providers should update their appointment processes to inform patients about these new rules. If you're using telemedicine platforms, make sure they are aware of the latest regulations to avoid billing issues. In summary, the recent changes focus on limiting telehealth to certain locations for Medicare, reducing audio-only coverage, and narrowing provider eligibility. But behavioral health and some special programs still enjoy flexibility. Staying informed will help you make the most of your telehealth options and avoid surprises when it's time for your appointment.